Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about corrosives. So corrosives, what is a corrosive? So corrosive is something that destroys tissue by its corrosive action. And what we generally perceive something to be corrosive is like if it changes heme into hematin. If the heme becomes hematin, we call it as a corrosive. And the corrosive that we usually deal with in our medical setup, the corrosive that we usually deal with is acid and alkali. These are the two important corrosive that we are going to see here also, and between these two it is acid that is very common, and that is the most important thing for answer also. So first, introducing the corrosives, what we have to know is like how it is causing all the damage, that we have to know. So first, what is the type of necrosis that they lead to? So you have alkali, you have acid. Now they will ask you what is the type of necrosis that you will get in alkali and acid substances. So here you have L, right? So L for liquefactive necrosis and C for coagulative necrosis. So this is what you usually get. So in stomach you have columnar epithelium and you have squamous epithelium in the esophagus, and this alkali compound, it will lead to liquefactive necrosis, that it will liquefy the tissues, and between these two it is always alkali that is dangerous, because it will liquefy the tissue and cause more damage. But this acid, since it coagulates the tissue, it will lead to Eschar formation. So there will be some hard tissue formation because of this coagulative necrosis. So because of that, it will not be able to penetrate more into the tissue. A scar will form, so the acid will not trickle down any further. So the damage will be limited. Unlike this alkali, where it will liquefy everything, you will have an extensive damage to the tissue. And between these stomach and esophagus, the most important thing is that this columnar epithelium of stomach, it is more resistant to alkali, and this squamous epithelium of esophagus, it is resistant to acid. So because of this, if it is an acid ingestion, it mostly affects stomach. So affected by acid ingestion. So in acid ingestion, you will be getting to see stomach perforation, damage to the stomach mucosa, all these things it will be seen in acid ingestion. And for esophageal injury, stricture formation, perforation, everything will be seen in alkali ingestion. So esophagus, it is affected by alkali ingestion. So this is the basic thing. So whatever we say corrosive, it will change the heme into hematin. There will be formation of hematin. When that happens, we call that substance to be corrosive. And the corrosive that we mainly see is acid and alkali. And acid is the most commonly found component in all household cleanings. So it is the most commonly encountered poisoning in our setup also. And these two, it will lead to necrosis of the tissue. By its corrosive action, it will lead to necrosis. And what is the type of necrosis that causes? For acid, just remember C, coagulative necrosis, and it will lead to Eschar formation. Alkali, it has this L, so it will cause liquefactive necrosis, which is really wider and more dangerous. There will be extensive damage because of this alkali ingestion. And the epithelium of stomach is columnar epithelium, and epithelium of esophagus is squamous epithelium. And these are like the columnar, it is resistant to alkali, and squamous is resistant to your acid. And these two ingestion will lead to, acid will lead to stomach damage, and esophageal damage is seen mostly in alkali ingestion. So this is a basic thing that we have to know. And now we are going to see about acid. So we will see in depth about acid ingestion. Acid. So acid, based on its physical property, we have divided the acid into organic and inorganic. Organic and inorganic, this inorganic is also known as mineral. So these both are same. When we say mineral acid, it is also known as inorganic acid. And all the acid that you normally encounter, sulphuric acid, nitric acid, hydrochloric acid, everything, the common acid that we encounter is the mineral acid or an inorganic acid. And organic acid is something very, very specific. And you have the carbolic acid, which is otherwise known as, carbolic acid is otherwise known as phenol. Then you have oxalic acid. So these are organic acid, and these are the most important acid that we usually come across, and poisoning happen with these acids only. So we will see in depth about each and every acid changes. So before we go into it, like for all the corrosive, especially this acid ingestion, there are certain features which is very, very common. Like you don't have to know which acid caused that, but you will get to see this feature and you will be able to see like some acid ingestion had happened. So there will be certain typical feature which will be common to all the acid ingestion. Maybe the degree of damage would be varying depending upon the concentration of the acid, but these are the changes that is usually seen. So first thing that you will be seeing is that if it is ingested, and most commonly it is ingested, you will be getting to see this. And there will be erosion and discoloration of oral mucosa. This is the first thing, like very striking thing. Externally you will be able to see. Whenever it is ingested, there will be some trickling down, right? So along the angle of the mouth, like here you will be seeing this discoloration, and along that area there will be some erosion also. And if you open the mouth, inside the oral cavity, all the mucosa, everything will be eroded and discolored also it will be. So this is the first thing that you will be seeing. Then you will go and you will open the pharynx. You will open the pharynx, then you will go to the esophagus, then stomach. So what will happen is that along all the way, your pharynx, esophagus, everything will be having very big congestion. It will be eroded. So the mucosa will be highly corroded by this corrosive nature of the acid, and you will see erosions along the pathway. So there will be erosion and congestion of pharynx and esophagus. Along the pathway, like where it travel, you will be able to see that. Sometimes there may be perforation also. Depending upon the acid that was used, you will be able to see very big perforation or stricture formation in the later period. And next thing that you can see is, if it is a really concentrated acid like sulphuric acid, you will be able to see highly congested and hemorrhagic stomach mucosa. So this is how it will look like. When you open the stomach, you will be able to see hematoma because of the hemorrhage. Like because of the corrosive nature, all the blood vessel in the stomach mucosa, it will start leaking blood. So the blood will accumulate and you will be sometimes able to see frank hematoma, or you will be able to see the streaks of hemorrhage. You will be able to see the spots, right? So the streak of hemorrhages will be seen along the mucosa, or simply they will be congested. You will not be able to appreciate frank blood, but you will be able to see that all the mucosa, it will be very reddish in color. So this is the commonest change that you can expect to see in all sort of acid ingestion. And if it is really concentrated acid, really powerful acid, you can also see perforation in the stomach, and so there can be peritonitis. If it is a late presentation, you can also see peritonitis and sepsis in those cases. So this is the common postmortem finding that you can expect to see in acid ingestion. Now we will start with boric acid. So this boric acid, it is also a mineral acid. So this is a mineral acid, and where it is used is that it was used as an antiseptic. In the initial period, when we did not come up with lot of chemicals, this boric acid was used as an antiseptic, and whenever this boric acid is consumed, what you can get is the normal corrosion. So first, every corrosive will have the corrosive action. So your oral mucosa, pharynx, everything, all the mucosa will be showing erosion, and apart from that, this boric acid, it will lead to metabolic acidosis. You will get metabolic acidosis and eventually resulting in renal failure. So this is the common presentation of boric acid ingestion, and you will be getting, because of that corrosive nature, erosion of the mucosa, you will be getting this vomiting. There will be dysphagia, there will be discomfort, and there will also be vomiting. And this vomiting, you will be getting dark color appearance because of the presence of blood. You will be getting dark color vomitus, and when it comes to contact with the skin, if there is skin contact, it will look like this. There will be boiled lobster appearance. So this is a boiled lobster, and the skin, it will somewhat resemble this boiled lobster. So what it means is that there will be erosion of the skin. You will be able to see skin erosion and redness and inflammation. So with boric acid, you can expect to see this boiled lobster appearance, dark color vomitus, and erosion of all the oral mucosa. And apart from that, you can also see metabolic acidosis and death by renal failure. So this is how boric acid presents, and boric acid, it was used as an antiseptic in the ancient period. So this is one mineral acid. Next, what we are going to see is sulphuric acid. This is the most important question. They will ask you whenever there is a question in this corrosive actions, they will be asking you like the presentation of the sulphuric acid. So sulphuric acid, it is one of the strong mineral acid. It has the strong corrosive action, and it is also known as oil of vitriol. It is very, very thick, oily consistency. And this sulphuric acid, it is used in lot of lab preparations. And what is the clinical feature of sulphuric acid? It is very important. So this sulphuric acid, it will lead to black discoloration, blackish discoloration of oral mucosa. You will also get chalky white teeth, and angle of mouth, you will be able to see some erosion and discoloration. So the point of entry, mouth, you will be able to see blackish discoloration, chalky white teeth, and along the angle of mouth, if there is any trickling down, you will be able to see discoloration and erosion over the skin. So this is the mouth. Afterwards, you can see the mucosa, pharyngeal mucosa, severely congested. So you will be able to see congestion of the pharyngeal mucosa, and esophagus will also be congested. Esophagus will be severely congested. And the vomitus, it has this typical coffee ground appearance. So what happens is that when it goes to the stomach, it will cause erosion of all blood vessels, and there will be leaking of blood, which will react with the acid and become darker in color. So the heme, it will become hematine. So the darker color, it will come out as a vomitus. Because of the discomfort, you will get the vomitus, and that vomitus, it will look like coffee. Like it will be dark colored appearance you will be getting. So this coffee ground appearance, they will ask you, it is seen in which acid ingestion? And chalky white teeth, it is seen in which acid ingestion, they will ask you. So vomitus you will be getting coffee ground appearance. Next, in stomach, this perforation is most common. Perforation is very common, and you can get severe hemorrhage and mucosal congestion. So, in stomach you can get severe hemorrhage and mucosal congestion along with the perforation. Sometimes you will be getting this perforation and perforation peritonitis also. And because of the perforation, there will be peritonitis and you can late sequelae. You can get this. So, these are the commonest thing that you will be seeing in the stomach. This acid, it is so strong that the stomach will be eroded so much that it will look like a thin blotting paper, like a butter paper. It will become very, very thin. So, blotting paper appearance of stomach, that is also seen in sulphuric acid. So, stomach becomes blotting paper like appearance in sulphuric acid. Coffee ground vomit is sulphuric acid. Peritonitis most common with sulphuric acid, and discoloration is black color along the mouth and chalky white teeth appearance is also seen in sulphuric acid. So, these are the clinical features of sulphuric acid, and sulphuric acid changes, it is usually asked as a question in the exam. And apart from that, in the postmortem period, all the postmortem changes, you will be able to see all the corrosive appearance. So, postmortem changes, like I told in the earlier, all the things will be similar. How the stomach will look like, how the mouth, esophagus, everything, how it will look like, and you will be able to see like death by acidosis or shock. So, there will be death by most commonly shock and perforation peritonitis. So, these are the commonest thing that we have to write in case of sulphuric acid ingestion. So, we have seen boric acid, sulphuric acid. Next, what we are going to see is carbolic acid. It is an organic acid. So, this carbolic acid, it is also known as phenol. And phenol we normally know where all we use phenol. For cleaning and all we use phenol, and it's still being used. And this phenol, it has this sweetish peculiar odor. And this organic acid, this carbolic acid, what is that? It consists of this chain, like it has this organic chain, and when it is absorbed, like it will be absorbed by all roots including skin. And when it is absorbed, the ring structure, it will be divided into pyrocatechol and hydroquinone. So, the carbolic acid, it will be divided into pyrocatechol and this hydroquinone. And this pyrocatechol, this is mainly all the metabolism, it happens in the liver. And when it is excreted in the urine, this pyrocatechol, when the metabolites excreted in urine will lead to green color urine. You will be getting green color urine, and this green color urine is known as Carboluria. So, Carboluria is greenish discoloration of urine that you get after ingestion of carbolic acid. So, how this green color happens? So, whenever carbolic acid is ingested, it will be cleaved into its metabolites in the liver, that is pyrocatechol and hydroquinone, and this when get added to the urine. So, this excreted via urine, this on long standing. So, what will happen in the urine? You will have these metabolites, and this metabolites on long standing, it will oxidize. On long standing, it will oxidize and give this green color urine. So this is basically Carboluria. Whenever you ingest carbolic acid, you will get this green color urine. And if you leave this green color for a very long time, the oxidation will become very much and the green color will become very dark, looking like a black color urine. So this is the most important thing in carbolic acid poisoning. And what is carbolism? They will ask you what is carbolism. Carbolism is poisoning by carbolic acid. So this is acute poisoning by carbolic acid and we give the term carbolism to the condition. So what all you can get is, so there will be skin changes. Whenever there is a contact with the skin, you will be getting numbness and there will be burns and erosion. So this carbolic acid, it will go directly affect the nerve fibers, peripheral nerve fibers it will affect and it will lead to numbness. Sometimes tingling sensation will also be seen and there will be burns of the skin that was coming in contact with the carbolic acid. So skin, this will act like that. Then after that what it will form is that it will lead to eschar formation. So in the skin you will be able to see this eschar. Because of its corrosive action, it will cause this eschar. And in the oral cavity, all mucosas starting from your pharynx, esophagus, stomach, everything will harden. So you will get esophagus, stomach, everything will become really hard and white. So it will become very hard structure and in the lungs there will be depression. So there will be dyspnea. So what this will do is, this will go depress all the things. So it will depress respiration, it will depress myocardial activity, it will depress CNS activity also. So everything there will be generalized depression. So the CNS and CVS will also be depression you can see and lungs there will be dyspnea and stridor. And liver toxicity will also happen. There will also be liver toxicity because that is where it is primarily metabolized, right? So liver toxicity will also happen in this phenolic acid poison, that is carbolism. And what is the treatment? What you can do is, first you have to prevent the absorption. If it is present over your dressing or over your skin, you have to remove it. You have to remove clothing and decontaminate. The whole area of exposure you have to decontaminate it. Apart from that, you can do gastric lavage. Generally for gastric lavage, acids and sharp objects, it is an absolute contraindication. Like whenever you come across a corrosive poison or a sharp object ingestion, you are not supposed to do this gastric lavage. But in carbolic acid, you can do gastric lavage. Why? Because this will lead to hardening of stomach, right? So because of the hardening of stomach, the perforation risk is very minimal. So you can do gastric lavage. So if they ask you which acid you can do this gastric lavage, where it is not contraindicated, you can say phenol acid ingestion, we can do gastric lavage. So gastric lavage, it is not contraindicated in this poisoning. And everything else is symptomatic management. We'll do symptomatic management. So this is acute poisoning. So what will happens like chronically, if people are getting exposed to phenol chronically, we call it as carbolic marasmus. In such condition, they will be experiencing CNS symptoms because of CNS depression. It will depress activity of the brain. So their symptoms they will be getting, and they will also be getting yellowish deposit in cartilages, which is known as Ochronosis. So this is also seen in chronic poisoning. Chronic poisoning, we call it as phenolic marasmus. There you will be getting this pigmentation, yellowish discoloration or deposit in the cartilage, which is known as Ochronosis. So this is acute poisoning carbolism. Chronic poison is carbolic marasmus. So this is the presentation. And post-mortem appearance, the main thing that we have to know is you will have leather bag stomach appearance. So all the things, all oral and GI mucosa, it will become hard. Because of that, you will get this hard stomach. So you will be getting this leather bag like stomach, and you will also be able to see erosions. And this is the most important thing, leather bag appearance and erosion will be seen all over the body. And you will be also able to appreciate the phenolic smell. So these are the things that you mainly encounter in carbolic acid poisoning. So carbolic acid, you will get Carboluria, which is green discoloration of urine, carbolism, acute poisoning, and chronic poisoning, it is carbolic marasmus. Ochronosis, that you will get another feature in this chronic poisoning. And in postmortem, you will be getting this leather bag appearance of stomach because of hardening of the mucosa in the GI and the oral tract. So this is the carbolic acid. And here sometimes what you can see is, like, because of the transdation, phenol, you will be able to see hard upper surface of liver and intestines. Those structure will also become hard, and you will be able to see the erosion, hemorrhagic mucosa in the stomach. So stomach mucosa, it will look like this. So these are the commonest changes you will be seeing in this carbolic acid ingestion. And next what we are going to see is hydrochloric acid. So this hydrochloric acid, its corrosive action is somewhat less than sulphuric acid. And mainly hydrochloric acid, you will be able to see all the corrosive changes, but it will be to a lesser degree. And it does not commonly leads to perforation. And next what we are going to see is nitric acid. So nitric acid, here you will be seeing something known as xanthoprotic reaction. You will be seeing xanthoprotic reaction, which is yellow discoloration of skin and mucosa. So all the thing that is coming in contact with this nitric acid, it will become yellow. That is because of this tyrosine, it will be converted. So this nitric acid, it will lead to xanthoprotic reaction, which will lead to yellowish discoloration of all the skin mucosa, all the structures it is coming in contact with it. So this yellowish discoloration will be striking. In postmortem, you will be able to appreciate this yellow discoloration. Apart from that, every other presentation will be similar to all other mineral acid. So acid, all the acid, you will have this common presentation. Discoloration, then all the mucosa, oral mucosa, GI mucosa, you will have the erosion. Stomach mucosa, there will be severe congestion or frank hemorrhage with hematoma. And in phenolic acid, you will be able to see this carbolism, which is acute poisoning, and chronic poisoning is also seen, and you will be able to see Carboluria, which is green discoloration of urine. So this is about acid. Now what you are going to see is another organic acid, that is oxalic acid. So here what happens is that these acid, apart from their corrosive action, they have few more action also. So this oxalic acid, it is also known as, this oxalic acid also known as acid of sugar or salt of sorrel. And this is mainly used in book binding and calico printing, and it is also used for ink removal. Illegal. Like during oating, they will put one ink on the finger, right? That ink it is normally not able to remove. But using this oxalic acid, you can remove that ink. So for that they use this oxalic acid. Sometimes this oxalic acid, it can be ingested, and when it is ingested, what it will do is, it will have this corrosion. So corrosive action will be there. But along with that, what it will do is, it will lead to formation of salt of calcium, a calcium oxalate. So it will lead to calcium oxalate salt formation. So because of that, so these are the calcium oxalate salt. It will look like an envelope shape. Okay, these salts envelope shaped, and because of this acid, like calcium formation, calcium oxalate formation, you will have hypocalcemia. This will result in hypocalcemia. So hypocalcemia, you will be able to see the Staucher's sign and Vostok sign. So here what will happen, when you inflate the cuff, when the pressure increases, there will be this position of the hand. So the hand will become flexed like this. So this happens because of hypocalcemia. And if you tap over the facial muscle over here in front of the ear, if you tap over here, the angle of the mouth, it will be retracted. So this is Vostok sign and Staucher's sign. Both happens in hypocalcemia conditions, and in oxalic acid poisoning, you will be able to see these changes also. So this is how the fingers will look like. And the vomitus that you will be seeing is dark color. And in oxalic acid poisoning, more than the corrosive action, this hypocalcemia will be prominently seen, and death happens because of this hypocalcemia only. So this is one acid which causes hypocalcemia. And next you have hydrofluoric acid. So this hydrofluoric acid, what is peculiarity is that it is a one acid that causes liquefactive necrosis. Generally, acid causes coagulative necrosis, but this acid, it causes liquefactive necrosis, and it has very strong burn. It causes very strong burn locally and very painful. So hydrofluoric acid, even a small amount, it can cause very painful burn, and this also leads to hypocalcemia and hypomagnesemia. So it will remove all the salt from the bone, and it will cause formation of the calcemia, and by calcium and magnesium salts, it will lead to formation. So this hydrofluoric acid, it can cause hypocalcemia and hypomagnesemia. So both oxalic acid and this hydrofluoric acid, they, apart from this corrosive action, they will cause hypocalcemia, and hydrofluoric acid, it will also cause hypomagnesemia. And these salts will become insoluble salts. They will go deposit all over the body, and because of this hypocalcemia and magnesemia, death will be resulted. So these are the important thing in the acid poisoning. Next, what we are going to see is alkali poisoning. So alkali poisoning, it is not as common as acid, but whenever you get alkali poisoning, this is mostly this poisoning, like battery cell. This battery cell ingestion. This is the most common mode where you will be getting this alkali. So like acid, it has the same corrosive action. Here it will be liquefactive erosion, right? So because of that, you will have much wider damage to the muscle. And whenever this battery ingestion, if it is getting obstructed, it should be promptly removed. Promptly removed earlier. Why? Because if you left it there, it can lead to esophageal perforation. So this is the main thing about this alkali. Most common alkali ingestion that you will see is this battery cell, and just like any foreign body, you cannot wait it to pass on its own. You have to earlier do an intervention and remove the battery, otherwise it will lead to esophageal erosion and stricture formation. Sometimes perforation can also happen. So this is all about the corrosive. So in this, you mainly have to remember the postmortem appearances, like how the stomach mucosa will be, what are the things that you can see in the oral mucosa, and sulfuric acid, what is the changes like chalky white teeth, black discoloration, blotting paper appearance of stomach. Carbolic acid, you had carbolism, Carboluria. These are very important in this corrosive, and for alkali you have this battery cell ingestion. So with this we are concluding this video. Thank you for watching.